Okay, hi everyone. My name is Sophia Morrison, and today I'm going to be presenting on the topic of mental health resources, specifically looking at affordability and accessibility of mental health support within the age group of adolescents and young adults. So, once again, my name is Sophia Morrison, and this is for Public Policy and Professional Ethics in Child Development. So, starting off here, I want to talk a little bit about some current research. So, a study conducted in 2021 found that 60% of college students within this young adult and adolescent age group are diagnosed with at least one mental health concern. So, it's really important to consider this within context. So, this has increased 50% since 2013. So, that's a pretty significant increase of mental health concerns. And this article does talk a little bit about how the COVID-19 pandemic is one probable factor that has increased mental health concerns. But this does show that mental health is a continuously growing and important issue to address within this demographic. So, in regards to legislation that addresses mental health services for adolescents and young adults, I'm going to speak about three different acts. So, we'll start with this first one, the Patient Protection and Affordable Care Act, also known as the ACA. So, this is very significant in reforming the US healthcare system more broadly. However, within the context of mental health, it improved care coordination, as well as majorly provided greater coverage for mental health conditions. So, mental health conditions have been historically underinsured for individuals. So, this act did help to increase coverage and provide coverage in lots of areas where it wasn't previously, as well as aiding in the development of Medicaid and Children's Health Insurance Program. So, next in 2015, we have Every Student Succeeds Act. This act provides or protects the needs of vulnerable student populations, specifically within talking about mental health. This increased and redistributed funding to be used specifically to address mental health concerns and behavioral health concerns for students. Next, we have the Mental Health Student Services Act of 2020, which provided grants to support the development of early school-based mental health programs for children. So this act is important because it focused on mental health interventions within the school system. So this addressed the needs of children by providing early intervention strategies and emerging mental health concerns. So this act is super important in considering this combination of serving children and their mental health needs while still working within the pre-existing school system. So next, for this slide, this photo slide, I want to talk about the impact of colleges and universities and how they can address the needs of this demographic for mental health concerns. So California's Mental Health Services Act, also known as Proposition 63, has worked to develop and implement preventative support and early intervention initiatives throughout the three major California school systems. So if you're not familiar, these school systems are the UC school system. So that's the University of California school system, the CSU school system, which San Diego State is within that system. And then lastly, the CCC system or community college or California Community College system. So all of these are public schools, and SDSU does offer or was impacted by this act as it fits within the CSU system. So here at SDSU, we have the Counseling and Psychological Services department, which is within Cal Poly Center, located on the fourth floor on campus. So they offer basic therapeutic resources, including short-term resources for therapy sessions and other options that are available typically for a short-term type of option. So it's important to mention that these are free for enrolled students. So of course, this doesn't mean they're free. We're paying for tuition, but they are included within tuition, free of cost, and without any proof of insurance needed. So these services are available for individuals, for couples, and also within group workshops. And there are some one-time services for students to access if needed. So for students that are experiencing more severe and intensive mental health concerns, um, they can be referred through C and PS. So they might not be able to have their needs met on campus, but this department can help to refer them to a professional so that they can get their mental health needs met somewhere else. Despite access to these resources, many students don't know that they exist. Um, and there's also a big stigma still around receiving mental health care. So, despite that these resources are available, they are underutilized by students at SDSU. Okay, so next, for adolescents and young adults who are in need of that more intensive care, often inpatient services are a step that families and individuals will take. So these type of services offer 24-hour care, which would not be able to be offered through outpatient care for more severe mental health concerns. So California law requires that certain mental health conditions be covered under state insurance plans. So these are most of the majorly recognized mental health conditions, as well as severe emotional disturbances, specifically in children. So these are known as SEDs. And these are also covered within insurance. However, these type of services are still very costly, even when covered by insurance. Um, Especially for individuals and families that do not have insurance or have limited insurance, residential care is extremely expensive. So this looks like costing anywhere from $320 to $1,930 per day, to $10,000 to $60,000 per month. So obviously this is not accessible for a large amount of the population, especially those who are in lower socioeconomic status. So in this picture, it's demonstrating Rady's Children's pediatric clinic, which has an inpatient mental health facility within this hospital. So um, many residential programs are within hospitals as shown, but there are also residential facilities that are independent. So there are different options for those that need to access this kind of support. Okay, so lastly, talking about adolescence and talking about adolescence, behavioral and mental health services are especially useful for this age group when offered through public school systems. So this is especially relevant when this can be done during the school day. So a majority of public and private schools offer mental health services to students. However, the employment of these type of resources is typically more inconsistent. So therefore, like despite that mental health resources are offered at these schools, they might not be implemented and delivered in the best way possible. So as of 2022, 96% of schools claim to offer at least one mental health service to students. Most commonly, this mental health service is one-on-one counseling. This counseling is typically done by either school staff or trained professionals. And but yeah, despite that, a majority of schools do offer mental health support. Most schools don't offer preliminary screenings for all students because of the difficulty to employ this kind of intervention on a larger scale. So, as you could probably think, these screenings are typically time intensive and they are expensive to employ. So, they are difficult to use like on a larger scale within a traditional school system. However, it is really great that it seems there is movement towards um, mental health intervention within public schools so that these resources are accessible to all students regardless of socioeconomic status. So these pictures depict Hoover High School, which is a local public school in San Diego that does offer some of these resources. Okay. So next, I'm gonna like move my head down over here. Next, we have the different ways that we could address the microsystem and the macro system. So within addressing this issue through the microsystem or through the self, it's I'm going to address young adults and college students. So firstly, it's so important that we make space to talk about mental health experiences and share these resources with loved ones. As I've mentioned throughout this presentation, um, a lot of resources are underutilized because there's a stigma around them, or people don't know how to access these resources. So talking about your own experience, how you received help, if you're comfortable, is a really great way to reduce the stigma and help others, especially your loved ones, receive mental health care. For adolescents, so those high school age students as well as parents, exploring mental health programs that are offered at either you or your child's school, and advocating for the implementation of those programs is so important, as well as taking the time to educate yourself and your child about what mental health concerns really look like, because many people might not be able to see that if they're not familiar, and then also what steps that they can take to access school resources if needed. So all of these are free and they are relatively easy to employ. However, they might not be as relevant or useful for adolescents and young adults that are experiencing severe mental health issues. So that is something to consider. Within the macro system, Campus Prevention and Recovery Services Students Act is something I really want to highlight. So this encourages collaborative work between the Department of Health and Human Services as well as the Department of Education to support mental health, and subsequently substance abuse on college campuses. So as I've kind of mentioned before, this combination of education and mental health resources that are offered through school systems is very empowering to those people in need. So, one major pro for this is that it provides a guide for higher education campuses to employ mental health services and offers college education regarding, or sorry, I'll go back, offers colleges education regarding how to utilize mental health funding in an effective manner. So, this is a really important piece of the puzzle. So funding is really important, but if we don't know how to properly utilize that funding and make it be the most efficient and effective in serving this community, that funding doesn't have the same power. So this act really helps to address that specific need. However, uh, it does not increase funding that's available to universities, and it is limited to supporting only young adults who are enrolled in universities. So once again, the mental health concerns are not just relevant to students who are enrolled in school. This is a wide span issue. So yes, this act does only address those students who are currently enrolled in a higher education school. So that is most of my presentation. I've listed some of my references here at the end of the presentation, but thank you so much for listening, and I hope you have a nice rest of your day.